Nursing is a profession that inherently has a lot of ethical dilemmas. The Code of Ethics has 10 provisions that were developed and published by the ANA and is used to guide nurses in their daily practice. We, as nurses, have an ethical obligation to the nursing profession and to our patients, and this code helps establish practice rules, research, health policy, work environments, and administration. It has been and continues to evolve as the healthcare field changes. Provision 1 states that all humans deserve compassion, dignity, and respect, despite any of their differences and biases nurses may have. Provision 2 says that while nurses may have conflicts of interest, we should set professional boundaries and evaluate safety. Provision 3 covers patient privacy and confidentiality, and that nurses should always be our patient's advocate. Provision 4 notes that nurses should work within the scope of our practice, monitor any delegated tasks, and allow others to express concerns without repercussion. Provision 5 mentions that nurses should care for their own health and safety, but act with personal integrity, courage, and vulnerability while rejecting discrimination. Provision 6 comments that nurses should reject any negatively established social norms within the workplace, like bullying and racism, and address any concerns through appropriate channels or regulatory bodies. Provision 7 remarks that continued research should be done to expand nursing knowledge, but any participant should have informed consent. And Provision 8 states that nurses should collaborate with a healthcare team that fosters listening, respect, mutual trust, recognition, and transparency. Provision 9 voices the need and the right that healthcare is universal, and nurses should engage in political and legislative processes to recognize and address challenges in healthcare. And finally, Provision 10 states that we have an obligation to create a sustainable nursing workforce, helping advance a good and healthy global society, such as reducing maternal and child mortality, bringing access to clean water, and providing disaster relief. The ANA Code of Ethics is important in nursing because it provides a clear framework of professional values, principles, and standards that guide nurses' actions and decisions. It ensures nurses prioritize patient safety, dignity, and rights while maintaining integrity, accountability, and compassion in practice. The code also helps navigate complex ethical situations, promotes trust between nurses and patients, and upholds the profession's credibility within society. In short, it serves as both a moral compass and professional standard that protects patients and supports nurses in delivering ethical, high-quality care.
Hey, Ms. Thompson. I'm here to, the doctor ordered some blood products because you need a transfusion. Your labs came with really low hemoglobin. Is that okay?
Oh my gosh, I can't do that. I'm a Jehovah's Witness. I don't want blood.
Really? That's okay. I respect your belief. We can go speak with the doctor and see if we can find any other treatments that we can do to keep you safe, okay?
That's gonna be okay. I don't have to get blood.
Please, yes, no. There's other solutions for you to respect your belief.
Thank you so much. I appreciate your support.
Hi, this is Nurse Valerie from Make Believe Hospital. I was calling to give a report on patient Jane Doe in room 123. Yes, thank you so much. So she is 3 days post-op of a right hip orthoplasty. She's going to be transferring today via ambulance. Around noon, she should arrive there in between 2 to 3 hours. We're gonna be sending her record via a secure electronic EMR, and you guys should receive that here in the next few moments. Do you have any questions or concerns?
No.
The end.
Action.
Miss McTavish.
Hi.
Hi, I'm Nurse Bob, and I'll be handling your case today. My, you have pretty eyes.
Oh, okay.
I'm
in a lot of pain. Can I have something?
Yes, let's say said you had some pain going on. So it's between 0 and 10. Where's your pain scale at?
It's a 7 right now.
Yeah, that's what they said. Okay, so the doctor did order you some Demerol. This will make you feel much better and take away some of that pain. All right. Have you had Demerol before?
No.
Okay, yeah, this is gonna do you right. 1 milliliter All right. Woo! Look at that. Whoopsie, a little leftover. We'll take some with you here. Ooh, bitter. So, how you feeling now?
What are you doing?
Let the Demerol take effect.
Okay.
Ah, you feel a little warm? A
Yeah,
little
I
fuzzy?
do feel a lot
you feel a little
better.
better?
Yeah. Yeah.
You know what? Me too, by the way. That's good. So, you really do have pretty eyes.
Thanks.
And, I was thinking when you get out of here, we should celebrate, and I'll buy you some drinks. We'll go for dinner. You sound
I
good?
could use an Aperol Spritz.
That's what I'm talking about. Very good. Do you have Facebook? Want to connect on Facebook?
Yeah, heck yeah. I have
Good
Instagram too.
All right, perfect. Nurse Bob, pull me up, and there we'll be. And
All right, I added you.
all right, that's a pleasure, my pleasure. And listen, I'll be seeing you later.
Thank you, Nurse Bob.
All right, you have a good day. Talk to you later.
You can first apply the Code of Ethics by acting as an advocate for your patients. Ensure that the patient is informed and capable of understanding all decisions about care to respect their right to choose. Advocate for their health and safety and being a voice for them when they need help. Do no harm to patients and treat them with the dignity and respect they deserve as a human being. Be beneficial to the patient and treat them indifferently from any other. Be honest and uphold the truth and be accountable for your actions by making sound decisions. Be committed to upholding and uplifting the profession of nursing. New problems and solutions occur on a daily basis in the nursing profession, and it is up to us as nurses to improve and be aware on their behalf. We must also work together as a team because it is through each other that we learn and advance. We must gather experience working alongside nurses and other clinicians with far more knowledge.